I'm Carla Hayden with the Enoch Pratt Free Library, and we're so delighted that you could be here today at the Central Library that's also the State Library Resource Center for Maryland. We are honored to be part of this special announcement with our wonderful mayor, and I'm sure many of you saw her recently on national television and everything, but also giving her State of the City address yesterday, Mayor Stephanie Rawlings-Blake. That was a sign for applause. I know you're in awe. I know, it's hard. This announcement will really start a wonderful partnership with the Baltimore City Health Department and the Division of Aging and Care Services. And I have to tell you, the library has had a wonderful partnership already with the Baltimore City Health Department over the years. Just a couple of weeks ago, a young mother named Sierra and her 4-month-old baby boy at our Pennsylvania Avenue branch was attending the Be More for Healthy Babies workshop. And she says she can't thank the library and the health department enough for the information that she received to take care of her newborn. And across the city at our Cherry Hill branch, we also spoke to a woman named Carolyn, who works in one of the city's food deserts. And she says that the virtual supermarket program makes a huge difference that allows her to buy fresh meats and produce that she can't buy in her community. So we're eager to have another partnership with the health department and expand it with the Department of Aging. And to that end, I'd like to welcome the Deputy Commissioner of Aging and Care, Arnold Eppel, to tell you more about it.
Thanks, Carl, and I appreciate everyone coming today. There's a number of very important people in the audience, and we'll recognize a number of you in a moment. But this is a really great time in that we have 23 libraries participating in this project. So we should be proud as we move this project along, as caregivers are becoming a very important and play an important role in our city. But without further ado, I want to introduce our mayor, Madam Mayor Stephanie Rawlings-Blake, who really worked hard as we continue to make things happen in Baltimore City. Mayor?
Arnold, thank you very much. Dr. Hayden, thank you for your incredible leadership, and Dr. Nguyen, I think there's a saying, hitting the ground running, but they need to come up with a different saying for Dr. Nguyen, because she is more than hitting the ground running as our health commissioner. I want to thank everyone for joining us today. I think by now you know a goal of my administration is to grow our city. Yes, you have to attract new residents to grow a city, but for me, the more important thing is giving those residents who are here more reasons to stay. I believe very strongly that our seniors are the backbone of our community, represent not just a large part of our population, but our seniors are a great resource. And I think you have to treat your resources like the assets and the precious commodities that our seniors are. And that means looking for innovative ways and collaborative ways to make sure that we are caring for our seniors. There is no way to grow our city if we don't plan for how to keep more seniors here. In fact, we know that more than 1 in 6 people living in Baltimore are 60 or older. Many of our seniors care for themselves and do a good job at it. But as our parents and loved ones get older, more and more of us are being asked to serve as caregivers for the older generation. For adults like me, in the age range of 30 to 64, and I won't tell you where I'm hitting in there are lots of demands on our time. And many of us in that age range have kids at home as well. Being asked to grocery shop for a family member, or we're being asked, to grocery shop for our senior family members, to take them to do their, run their errands, to do their appointments. We take our own kids to the doctor. We take ourselves to the doctor. Then we have to take our loved ones, our seniors, as well. You know, it is, as much as we want to do, there's only so much time, you know, for us to be able to take care of all of those responsibilities. It is hard work trying to juggle all of those things. And too often, the first thing you say is yes, without figuring out how. And certainly without knowing all of the resources that are out there to help. By setting up the Caregivers Corner in 23 branches of the Enoch Pratt Free Library, we're going to provide critical information to families all across our city. Our caregivers, our family caregivers, and our older adults who don't know what resources are available in the community will have a convenient place to go. And I hope you understand or you see the demonstration of, through Dr. Hayton, that our library system is more than a place where you do research for a paper. It's more than just a place where you can go get your latest romance novel that you're too ashamed to buy in the store, but you can come and, you know, it's more than that. Dr. Hayden works every single day to make sure that our library stays relevant in the lives of the people in the community. It's not just making sure that you can borrow a book more efficiently or rent a movie more efficient. No, it's about connecting people in the community with the resources that they need. That's why even in when we had our lean budget years and the resources were short all around, and certainly for the library, the number of users continued to go up. And that's about using the resources that you have more effectively and efficiently and responsibly to make sure that you're protecting those priorities. And that's what this Caregivers Corner is about. I want to thank our Health Commissioner, Dr. Lena Nguyen. When I think about this partnership and I know about all of the things that she has planned, I'm excited about what the future holds, especially when it comes to our seniors. She has a passion about for patient-centered health and wants to focus on making sure the whole spectrum, whether you're a Be More for Healthy baby or a Be More for Healthy senior, that you are covered. And I think this partnership is an example of that. I want to thank Arnold. You've been great. You bring a energy and a commitment to connecting our seniors to the resources that are out there that is so important in order to make sure that we're getting this right. And again, I want to thank Dr. Hayden. We have an amazing, amazing head or CEO of our libraries. She is, I'd say it all the time, she's a rock star librarian, known across the country. And is, in leadership in the U.S. Conference of Mayors, and usually when you go and you're talking with other mayors, they know your police commissioner, they might know your fire chief. People ask me about my librarian, and I said, don't get any ideas. Do not get any ideas. I have to fight you for. We know that by working together, we can make a difference, and we are making a difference. So I want to thank you again for being here. Thank you for spreading the word, and thank you in advance for the future partnerships that we are going to make to improve the quality of life for our seniors. And I'll turn it back to Arnold right now. Thank you very much.
Thank you, Madam Mayor. It's really important to recognize how the Caregiver Corner will change and will help folks connect and resource. It's really hard to find resources when you have a real problem in your family because you never plan for catastrophes or illnesses. And so where do you turn? Help, health, mom, dad. A library is a good spot. I now have the pleasure of introducing our new health commissioner, as Madam Mayor noted, hitting the ground running about 6 weeks ago, I'm going to think. But we have been doing a roller coaster as we move forward with lots of new projects. And I'd like to introduce you to Dr. Lena Nguyen.
Thank you very much. I'm so honored to be here today, and again to follow our mayor, who, as you may know, yesterday she gave a phenomenal State of the City address in which she talked about the work that she's been doing over the years to make our city healthier and stronger, to attract new families, and in a way that really embraces our seniors, who are the backbone of our society in every way. I'm so thrilled also to be here today with Arnold Eppel, our Deputy Commissioner, and with Dr. Carla Hayden. Carla and Arnold had the vision for this project, for the Caregiver Corner project, and they've worked together to make this dream a reality. And I also want to take this chance to thank Dr. Alan Jensen as well, because he was someone who really made this happen. Now, we have a number of people here who are from the Commission on Aging. Can you all stand up and be recognized as well? Thank you. So I want to share a personal story with you to help to illustrate the importance of Caregivers Corner. When I was a medical student, my mother, Sandy, who was a school teacher in Los Angeles, began feeling run down and tired and just not herself. She was in her early 40s and so was in good health, and nobody thought there was anything wrong with her. And it took nearly a year before she was finally diagnosed with what turned out to be metastatic cancer that by then had spread to her lungs and her bones and her brain. My mother became very ill, and I became her caregiver for 8 years. And I watched as she bravely fought her cancer with multiple rounds of chemotherapy and surgery and radiation. I never thought that I would become a caregiver so early in my life, but this is a reality that many of us face. We may never be ready for it, but you know what? Our loved ones are not ready to have cancer or heart disease or hip fractures or dementia. And we all know that we have to do what we must do. But that's why being a caregiver is one of the most overwhelming and most humbling jobs that a person can have. So we step in and we're there to do what needs to be done. We help and feed and bathe our loved ones. We schedule medical appointments. We cook. We shop. We pay their bills. And we do all of this while juggling our own work and family responsibilities, and often with very limited financial resources and no training on how to be a caregiver. The job of a caregiver is not an easy one, and I can tell you from personal experience that it's frightening and overwhelming and often isolating. And we know this based on data here in Baltimore City as well. Our caregivers in the city spend an average of 82 hours per week providing care. That's a full-time job. 55% of Baltimore City caregivers report that they need more financial support, and 46% say that they need more rest and more resources to help them. And that's why, under the leadership of Mayor Rawlings-Blake, we're launching the Caregiver Corner project. This initiative gives our city residents and our city's caregivers a chance to connect with each other and help to support one another. It also gives us a chance to celebrate our caregivers and give them the resources they need to better care for themselves, so that they can care for our loved ones too. So I want to thank again Arnold Eppel and also Dr. Hayden and our mayor and Dr. Jensen and so many others who have come together today to make this project a reality for all of our citizens. Thank you all very much.
So I just want to thank a few people that really made this happen. I want to thank some of the people behind the scenes that can set the stage and put the chairs. And I want to thank Miss Eunice Anderson, who I've kind of grown to have a little relationship as we talked throughout getting this thing going. So I thank you, Miss Anderson, for your help. Samantha Gardner, our deputy, I appreciate all your help. And Teresa and Jeter Cutting, Eloise Main, Thelma Wynn, Deborah Hamilton. Deborah Hamilton is our ombudsman, and she said to me, already this just got set up this week, and she already had a call from a volunteer interested in helping in a nursing home. And so, you know, that we can certainly recognize how this is going to play an important role in our community. I also want to thank the Alzheimer's Association, Ms. Jennings, for coming, And we open our rack for your information as you leave it here in all 23 libraries with Eileen Rosenthal and others. So we appreciate all that you do. Dan Hale, I see from the Hopkins program, working with Weinberg, and of course Ken Strong from our housing program. And I know I'm going to miss our senior centers. A number of senior center directors came as well today, so we thank you. And Meals on Wheels. So we also ask that you put your literature in our racks because we've got to get that important information out from Meals on Wheels. And most important, Jose Jimenez, who set this project up, and he came in about, 3-4 weeks ago already, and he's hit the ground running as well, and we've been working this project, and he has been so instrumental in making today a reality. So I see a couple more senior center directors in the back. So I thank you very much. Our challenge is going to keep these racks full because I got a funny feeling this information is going to fly off the racks here at the library. One of the most important pieces, the Community Resource Directory, which has all the valuable resources that our older adults and families need. So again, I thank you, and I apologize for anyone I might have missed as we went through here. Rebecca Bradley, did I mention you? Because all the work you do in Medicare Part D is tremendous. So I thank you very much for coming today.